Assalamu alaikum and good morning to one and all. Today we'll study about part 1 of bronchial asthma and its treatment. At the end of this e-learning session, you are able to discuss characteristics, manifestation and pathophysiology of asthma, and we'll also see about classification of anti-asthmatic drugs. Let's see about the characteristic of the bronchial asthma. So bronchial asthma, it is basically characterized by four important attributes. So the first attributes of the bronchial asthma, it is hyper-responsiveness of bronchial smooth muscle. So the bronchial smooth muscle, their response become increased by many fold. So this increase in response of bronchial smooth muscle, it is called as hyper-responsiveness. So what is the response of the bronchi? So in case of the normal bronchi, the bronchi should contract and it should relax. So during the relaxation of the bronchi or the lungs, it accommodate your inspired air. So whatever air you have inhaled, it is accommodated during the relaxation phase of the bronchi. Whereas during the contraction, this air which is taken through the inhalation, it will be forced into the blood so that oxygenated blood goes into the blood vessels, and the carbon dioxide, it is exhaled from the lungs. Okay, so this is the normal process. But what happened during hyper responsiveness? Due to hyper responsiveness, instead of having alternate contraction and relaxation, the contraction phase that is increased. So there is increase in contraction. So due to increase in contraction, what happened? Your bronchi, which earlier accommodate more air, it is now not able to accommodate that much amount of the air, and as a result of that, patients start showing different symptoms of asthma. So the first important attributes of bronchial asthma, it is hyper responsiveness of bronchial smooth muscle. Let's see what happened due to this. Due to hyper responsiveness of bronchial smooth muscle, it result in narrowing of air tube, right? Because there is more contraction. So suppose if this is the normal bronchi, so this is the lumen of the normal bronchi, where it can properly able to contract and relax. Now due to hyperresponsiveness, which phase it is increased? The contraction it is increased. Due to increase in contraction, the lumen size will decrease. So now you can see the lumen size is decreased. So there is a narrowing of this air tube or the lumen of the bronchi. So this is the second attributes. Then it often accompanied by there is increase in secretion. So it doesn't stop only here, but in addition to this, there is, in addition to narrowing of the air tube, there is increase in secretion. So what is secreted in the bronchi? Especially in bronchi, there is bronchial secretion, and that is called as the mucus. So there is more secretion of the mucus. So now there is narrowing of the air tube. In addition to that, now there is secretion of the mucus, right? So now when there is more secretion of the mucus along with the narrowing of the air tube due to hyper responsiveness of the bronchial smooth muscle, it complicates the condition of asthmatic patient. Okay, and lastly, the patient show the mucosal edema. Why patient will show mucosal edema? Because when there is contraction, when bronchi is not able to completely relax, it will release many the autocoids or the biological compound which are responsible for the inflammation. So it produces the mucosal edema, and when mucus it stay at one place, when mucus it is staying at one place, the earlier the consistency it is not that viscous, but when it stay at one place, this mucus become tight, and when mucus become tight, the mucus will form the plugging. So there will be the mucus plugging. It means these bronchial lumen will be blocked by the mucus plugging, and due to blockage of the bronchial lumen by the mucus plugging, the narrowing of the lumen, right, the patient will not able to accommodate the required air which is needed for the complete body to suffice their normal functioning or to do their normal functioning. So the oxygen supply to the complete body it is reduced, so their oxygen saturation it is decreased. The person will start, in order to maintain this oxygen level, person will start showing different symptoms. So these are four important characteristics of the bronchial asthma. Now let's see what symptom patients show in case of bronchial asthma due to these problem. So those symptoms are called as the manifestation, right? So the symptom shown in case of the asthma, it is called as the manifestation. So the manifestation of the bronchial asthma or the symptoms, it includes, first it is the dyspnea. What is dyspnea? The dyspnea, it is basically the breathlessness, where the patient feel that he want to breathe, but he is unable to breathe. So that condition, it is called as the dyspnea. Okay, so the dyspnea, it is one of the symptom. The second symptom, it is the wheezing. What do you mean by wheezing? When patients show the sound, there is peculiar sound during the breathing, that is called as the wheezing. So I will just show you demonstration how there is the sound. Like if you are breathing and if you are suffering from the asthma, you will breathe something like this, like right. So if this type of sound is there, this sound, it is called as a wheezing. So this is seen in case of the patient suffering from the asthma. There will be the cough. Obviously cough will be there because the sputum, it is accumulated. This sputum will produce the cough response, and then there will be the acute breathlessness, where patient feel that there is no oxygen in the body, right? So he will suffer from acute breathlessness, and it due to the plugging of the mucus or the excessive secretion of the mucus in the lungs, there will be tightness in the chest. So all these symptoms are related to the four characteristics of the bronchial asthma, and these are due to those characteristics. Okay, so dyspnea, wheezing, cough, breathlessness, the tightness of the chest. So these are the four these are the few manifestations of the bronchial asthma. Now let's see what are the causes of bronchial asthma, what are the reasons which are responsible for the patient who is suffering from the asthma. So let's see. So first important reason, it is the allergy. So most of the patient, they suffer from the asthma due to the allergic reaction. Okay, and in allergic reactions, the allergens play very important roles. So the allergens are responsible for the asthma in many of the cases. So what are the different allergen which can produce the bronchial asthma? So first allergen, it is the mites. So this is just one representative image of the mites. There are many types of mites which are generally present under the carpet. They are present in your bed, and when these come in your contact, and if you have allergy to the mites, you will start showing the symptom of the allergy and sometimes bronchial asthma. Okay, second could be the dust. So dust, especially in case of if you have opened the old book which is kept at one place for more time, then in such case when you open it, what will happen? When you open and close, there will be the dusting, and this dusting, or when this dust, when you inhale, you may suffer from the allergy. So not all patients, but those who are allergic to these dust, they only show the symptom of the allergy. Okay, so the dust could be the second allergen. Third one, it is the plant pollen. So those who have the bronchial asthma in case of special season, right, and that is also called as the seasonal asthma. So if for example, if they are normal in maybe in the summer season, maybe during the winter or during the rainy season, they are suffering from the asthma. Why it happen? Because during rainy season there will be the flowering on the plant, and due to flowering of the plant will release many pollen grain into the environment, and when you inhale those pollen grain, and if you have the allergy to the pollen grain, you will suffer from the bronchial asthma, right? So plant pollen grain, it is also one of the allergen. Fourth one could be the hair and fur of the animals. So some of the patient, they are allergic to the hair and fur of especially domestic animal. For example, in case of the dogs or cats, so if you are coming in contact with their hair and furs, you may suffer from the allergy. Then food, some patients, they are allergic to the food. When they take specific food, they suddenly suffer from hypersensitivity reaction or anaphylactic shock. So food could be one of the also reason. And lastly, some patients, they are allergic to the drugs, enzymes and antibiotics. So the allergy, it's play a very important role in case of the bronchial asthma, where you are coming in contact with different allergen. Okay, so this is one of the reason. Second factor or second cause could be the genetic factor. Okay, so in those patients who have a abnormal genes, and those patients, if they are coming in contact with allergen, they will release excessive amount of particular antibody in the body, in your lungs, and those antibodies are responsible for different symptoms of the asthma. Now let's see how it's happened. So there is excessive production of the antibody. which is specific to the allergy. So which antibody is specific to allergy? We have seen in case of hypersensitivity reaction. So specifically it is related to the IgE type. Okay, so most of the IgE type antibodies, they are seen or their level it is increased in case of the allergy. So if you have allergy and if you want to confirm it, how you will do that? You can take the blood sample and see the level of this antibody. If the level it is high, it means you are suffering from this problem due to excessive release of this antibody. So if you can control this level of the antibody, you can easily control the different manifestation of the bronchial asthma. So when there is excessive production of the antibody which is specific to the allergy, the condition it is called as atopy. So those patients are called as atopic patient, or that condition it is called as the atopy. So the atopy, it is the significant factor which is responsible for the asthma. So it is very important factor in case of the asthma. So we have seen two important factors. One it is the allergy and second one it is the genetic factor. Now let's see about the pathophysiology, because it is very important in order to target your medicine, because based on pathophysiology only you are deciding what target should be there in order to control the disease or in order to control the bronchial asthma in that particular patient. So you first identify what is the cause, then accordingly you can give the treatment. Secondly, you can see what is the pathophysiology behind this, and based on that pathophysiology you can give different types of medicine to control it so that there is no bronchial asthma, right? So the pathophysiology of bronchial asthma, it is difficult to predict because there are multiple factors are involved in the pathophysiology of the bronchial asthma. But it is seen that the disease is mostly related to type 1 hypersensitivity reaction. Okay, we have seen there are two types of hypersensitivity reaction, type 1 and type 2. But in case of asthma, the disease it is mostly related to type 1 hypersensitivity reaction, right? And when patients suffer from this type 1 hypersensitivity reaction, or it is also called as the allergic reaction, it consists of three important phases. So the first phase, it is the immune phase, and we'll see this phase in a detail. Second phase, it is pathochemical phase, and third phase, it is pathophysiological phase. Okay, so there are three phases, and now we'll see those three phases one by one. Okay, because based on this we'll be giving the medicine so that we can able to control bronchial asthma. So that is very important. So first phase, it is the immune phase. Okay, so in immune phase what happens, the allergens are coming in contact with the airway. So when the allergens are entered, so we have seen the different example of the allergen, like the dust, the mites, the hair fur, okay, then pollen grains and some allergens which may be present in the environment. When you are coming in contact with these allergens, and when these allergens are entered into the bronchial smooth muscle, what happens further, your body, in order to stop this allergen, right? So now you just look at this image. So what you are doing, your body will try to stop this allergen to attack your body, right? So in process or in this process, your body T cells and B cells are activated. So the T cell and B cell are called as immune competent cell. So there will be activation of immune competent T cell and B cell. And when this T cell and B cells in the blood it is activated, these cell, what they will do, they will produce as the antibody. So there will be release of the antibody from the immune competent cell. So now what happened here, the allergens, it is called as the antigen. So in response to the antigen, your T cell and B cell will produce as the antibody. Since here antibody are produced in response to antigen, the immune phase, it is also called as antigen antibody phase. Okay, so easy to remember why it is called as antigen antibody phase, because in immune cells there is production of the antibody, or there is release of the antibody by immune competent cells in response to the antigen, that are the allergen. So it is called as antigen antibody phase. Now antibody are just produced by this immune competent cell. Now what this antibody will do, further this antibody in bronchi, this antibody in the bronchi will bind to the different cell which are present in your bronchial smooth muscle. So they will bind to the basophil. So basophil are present in bronchial smooth muscle. They will bind to the mast cell, and they will also bind to the eosinophil. Okay, so when this antibody through the blood, when they are coming into contact with the bronchial smooth muscle, in bronchial smooth muscle they will be binding to these three important cells, right? Basophil, mast cells, and third one, it is the eosinophil. And when these cells are bind to these particular cells in bronchial smooth muscle, till this point, it is called as the phase 1, that is the immune phase of the allergic reaction, right? So only there is antigen, it is released by immune competent cells, and this antibody now inside the bronchi, they bind to the basophil, mast cell, and eosinophil. Now next, we'll see the next phase of the allergic reaction, and let's see what happened in that phase. So what is the second phase? That is the pathochemical phase. Now up to the first phase, just there is release of the antibody and binding of that antibody in bronchial smooth muscle to the basophil, eosinophil, and mast cell. But there is no yet release of the chemical, right? Now when these antigen and antibody bind to each other, it is called as antigen antibody reaction, right? In response to this antigen antibody reaction, your basophil, mast cells, and eosinophil inside the membrane of bronchial smooth muscle, it will produce as different chemical. So there will be the release of the chemical, because antibody is bind to the antigen, or antibody is bind to this cell, mast cell, basophil, and eosinophil. When they bind to this cell, the membrane of bronchial smooth muscle will produces biological active substances, and we have seen all these biological substances in the autocoid chapter, right? So all 9 session on the of the autocoid chapters are on these biologically active substances, and we have seen their pharmacological action in a detail. And all these autocoid, they produces contraction of the bronchi, and they also produces inflammation in the bronchi, isn't it? So it produces the histamine, and we have seen what is the action of the histamine in the bronchi. It produces the 5-HT, it releases the prostaglandin, it releases the leukotriene, and it releases the thromboxane, and many more, right? And most of these autocoids, or most of these biological active substances, what they does, they produces the bronchial contraction, increases the mucus secretion, and they enhance the edema formation as well as inflammation in the lungs, right? So why does it happen? Because these biological active substances are released by smooth muscle of the bronchi in response to binding of antibody to the basophil, mast cells, and eosinophil membrane. Okay. Now, when these chemicals are released, this phase of the allergy, it is called as pathochemical phase. So what happens in pathochemical phase? Just there is release of biological active substances which are responsible for the different characteristic features of the asthma. So when these chemicals are released, it is called as pathochemical phase, right? Now, up to this phase only there is release of the chemical. Now when these chemicals are released, what they further do? So the further stage, it is pathophysiological phase. Now in pathochemical phase, till patient not start showing the symptom of the asthma, but when these chemicals are released inside the body, what will happen due to that? Due to this chemical, your bronchial smooth muscle will have the inflammation. So there will be the inflammation of the bronchial smooth muscle. There will be the mucus edema, because it produces excessive secretion of the mucus, and due to that there will be the edema inside your bronchial smooth muscle. There is the hypersecretion of the mucus, so just now we have seen. Then accumulation of the exudate in bronchial lumen, right? So these exudate will start accumulating inside the bronchial lumen, right? And somewhere the bronchial lumens get blocked due to this exudate, okay? And overall, due to all those problems which is produced by the different chemical release in pathochemical phase, now patient will start showing the symptom of asthmatic attack. Okay, so the asthmatic attack will not produce unless unless the biological active substances produces inflammation, mucus edema, hypersecretion of the mucus, and accumulation of exudate in the bronchial lumen. Okay, so once it is done, then patient will show the symptom of asthmatic attack. So all those symptoms, dyspnea, breathlessness, wheezing, tightness in the chest, okay, so all those symptoms will produce in pathophysiological phase of the allergy. So now we have seen 3 phases of the allergic reaction. immune phase where there is release when antigen come in contact with the body cell, body will produce the antibody bind to the different immune cell, that those are the basophil, eosinophils and mast cell. Okay, and second phase, what happen when they bind to these cells, the membrane of these cells will release different biological active chemicals, histamine, 5-HT, leukotriene and many more. And in third phase, pathochemical phase, this chemical will produce some pharmacological action in the bronchi like inflammation, mucous edema, hypersecretion of the mucus, accumulation of the exudate, which is responsible for the asthmatic attack. So this stage, it is called as pathophysiological phase of the asthma or the allergic reaction. Okay, so this we have seen the three phases of the allergic reaction. Now let's see about the management. So we have seen the pathophysiology, we have seen what are the problem happen in case of bronchi. Now we can see how you can deal with this problem and how you can treat the patient suffering from the asthma. So do remember that the most important thing in case of the asthma, it is preventive measure, because if you know, if you have allergy to certain things and those things are responsible for the bronchial asthma, then very important thing is to take the preventive measure. So what it could be the preventive measure? So use of the mask could be very good preventive measure. Okay, so what you can do, you can avoid the contact with the allergen. So we have seen the different allergen like mites, the dust, the pollen grain, the food, or all those things. So you can avoid the contact with those particular allergen, right? So this is very important in the treatment of the asthma which is related to allergic reaction. If you cannot do that, suppose if it is not possible, every time putting mask, it is not practical. And I hope, I know you all are agreed to this point, because you maybe due to putting mask itself you suffer from breathlessness, isn't it? So if it is impossible, then another way for this treatment, and that is generally used in case of homeopathic medication, that is called as hyposensitization. So what you are doing in case of hyposensitization, to the patient himself you are giving the dose of allergen, okay, but you are giving the low dose or much more diluted dose of the allergen, and when patient take this the dose of the allergen, the patient body will produces the antibody, right? When you are taking this at the smaller dose regularly, now what will happen, your body become in control manner, your body will produce the antibody, because your body it is habituated to that particular allergen. When you are habituated to that particular allergen, now when next time when you are coming in contact with that particular allergen, your body will not respond in hyper way, right? Because we have seen what is important characteristic feature of asthma, there is hyper responsiveness of bronchial smooth muscle, right? And you don't want that hyper responsiveness, you want response, but you want normal response, you don't want hyper response, right? So you can use these allergen so that your body can be habituated to that particular allergens and can produce the antibody in controlled way. So instead of hyper response, there should be the regular response, right? So this treatment, it is called as hyposensitization with the standard allergen. So you can see in a detail on internet, you can just Google out, you will come to know how you can treat this patient by using hyposensitization. Okay, so this is the second method. And lastly, that is our interest, that is very important in terms of pharmacology, it is the drug therapy, right? So in case of the treatment of asthma, you are giving two important category of the drug. First important it is category, it is anti-inflammatory drug, because we have seen in case of bronchial asthma, patients suffer from the inflammation of the lumen. So if you can control the inflammation of the lumen diameter will increase, and due to increase in the luminary diameter, your lungs will accommodate more air inside the lungs, okay, and as a result of that, the symptom of breathlessness will reduce. So you can use one category of the drug that is very important, that is anti-inflammatory. Second category, you can use bronchodilatory drug, because important characteristics in case of asthma, it is hyper responsiveness, more contraction of the bronchi. So due to contraction of the bronchi, what is happening, there is narrowing of the lumen size or narrowing of the bronchial tubes. So how you can treat this narrowing of the bronchial tube? You can give bronchodilator. which can dilate this bronchial tube so that more air can be accommodated. So these are two important categories of the drug which can be used for the treatment of bronchial asthma. Now let's see the classification on this category with example. So the first category is anti-inflammatory. So belong to the anti-inflammatory category of the drug. You can, again, there is sub classification. So first class, it is hormone containing drug. So hormone containing drug, example, corticosteroid. So you know that in most of the asthma pump that is used by the patient suffering from the asthma, you are using corticosteroid, right? Or you are using the bronchodilator like salbutamol pump is also available, right? So the hormone containing drug, example, corticosteroid. So corticosteroid can be given in two ways. So the first way, by using systemic dose, you can give through orally or you can give through IV injection. So example of this type of corticosteroid are hydrocortisone and prednisolone. So you are giving either orally or you can give through the IV injection in case of the emergency condition, in case of very severe asthmatic attack. Okay. And second way, as I have mentioned earlier, through the inhalation. So inhalation, it is very good way of giving this drug, because you don't want corticosteroid to show action on different part of the body, because corticosteroids are not good. So exposing systematically, you are exposing corticosteroid to different systems and body, right? So that is not good. So what you can do, you can give through the inhalation so that the systematic exposure it is less, and you can have the specific exposure on the lung. Okay, so you can give through the different pumps. So the drug belong to this category are the beclomethasone dipropionate or budesonide. So it is also very good inhalation corticosteroid. Second category, it is non-hormone containing. So drug belong to this category are mast cell stabilizer. So they just stabilize the mast cell so that there is no release of the chemical. So if you can stabilize them, their membrane, there is no release of the histamine, 5-HT, leukotriene, and since these chemicals are not released, it will not produce pathophysiological phase, and there is no symptom of the asthma. So you can use mast cell stabilizer. Secondly, you can use leukotriene antagonist, example montelukast and zehrelukast. So these are also anti-inflammatory, because the leukotrienes, we have seen in last lecture, they are responsible for the inflammation. So if you can antagonize leukotriene receptor by giving montelukast and zehrelukast, although leukotrienes are there, they will not bind to the receptor and it won't produce the inflammation. So this is second category, right, of anti-inflammatory drug. Now let's see the second class, that is bronchodilator. So amongst the class of bronchodilator, again there are three subclass. First one, it is anticholinergic drug like ipratropium bromide and tiotropium, because acetylcholine in bronchi produces the contraction. So if you can antagonize their response, you can get very good bronchodilatory action. So you can use anticholinergic drug. You can also use beta-2 agonistic drug like salbutamol, terbutaline, formoterol, ephedrine. So from this category, the salbutamol, it is a widely sold anti-asthmatic drug. It is beta-2 agonist. Due to its beta-2 agonistic action, it produces the dilatation of the bronchi. And last category, it is methylxanthine. We'll see their action in detail in next lecture. So now this point you just remember, belong to the class of methylxanthine. The example, it is theophylline and aminophylline. So both are very good bronchodilator there, which is used in the treatment of the asthma. So to summarize, the anti-asthmatic drug are broadly classified into two categories: anti-inflammatory and bronchodilators. Okay, if you can able to have this action, you can control all the symptoms of the asthma. So I have done with my today's session. Thanks for watching the session. If you like this session, then do remember to give me a thumbs up.